This video will describe the details of the Pterygopalatine fossa, the nasal cavities, and the nasal sinuses. In the presentation of the cranial cavity, you learned about the osteology of the anterior, middle, and posterior cranial fossae. Here we will review the structures which are most pertinent to the nasal cavities and the Pterygopalatine fossa. Within the middle cranial fossa are a number of foramina which transmit various cranial nerves. For example, the foramen rotundum, shown here, transmits cranial nerve V2, which represents the maxillary division of the trigeminal nerve. As you will appreciate momentarily, the foramen rotundum opens anteriorly into the Pterygopalatine fossa. Visible within the anterior cranial fossa is the crista galli of the ethmoid bone, along with the cribriform plate, as shown here. Recognize that the cribriform plate has a number of olfactory foramina within it in order to allow for the transmission of the olfactory nerves. This plate helps to form the roof of the nasal cavity. The floor of the nasal cavity is formed by the palatine process of the maxillary bone, as shown here in purple. In addition, it's also formed by the palatine bone, specifically the horizontal plate of the palatine bone, shown here. And dividing the left from the right nasal cavity is the nasal septum, of which the vomer is a component of the nasal septum. Next is the foramen lacerum, as shown here. In life, this is not a true foramen, it is simply a space between two bones which is filled by fibrocartilage. The internal carotid artery enters into the middle cranial fossa just superior to this fibrocartilage as it courses through the carotid canal. When we discuss how the parasympathetics associated with cranial nerve 7 reach the lacrimal gland, as well as the small glands in the nasal cavity and along the palate, we'll discuss the foramen lacerum and its role in transmitting a small nerve called the greater petrosal nerve. The greater petrosal nerve slips out through the greater petrosal hiatus, and it runs along the floor of the middle cranial fossa, and it exits the cranial cavity via the foramen lacerum. More on this in a moment. Other bones pertinent to the nasal cavities include the nasal bones, shown here. The vomer, we've already mentioned. This is a plow-shaped bone that helps to form the lower aspect of the nasal septum. There's also the perpendicular plate of the ethmoid bone, which helps to form the posterior superior aspect of the nasal septum. And of course, the maxillary bone itself forms most of the lateral walls of the nasal cavities. Now let's take a close look at the Pterygopalatine fossa. The Pterygopalatine fossa is a deep space located near the center of the head. It exists in close proximity to both the temporal and infratemporal fossae. Here in the image on the left, the zygomatic arch has been removed to better visualize this space. Notice above is the temporal fossa in orange, and below is the infratemporal fossa shaded in purple. And deep toward the center of the skull lives the Pterygopalatine fossa. This fossa is shaped like an inverted teardrop. The Pterygopalatine fossa is located medial to the infratemporal fossa and is immediately posterior to the maxilla, as shown here. This large teardrop-shaped opening, which enters into the Pterygopalatine fossa, is referred to as the pterygomaxillary fissure. The pterygomaxillary fissure is outlined here by the green dotted line. The Pterygopalatine fossa is bounded anteriorly by the posterior surface of the maxilla, shown in purple. Posteriorly, it is bounded by the pterygoid plate of the sphenoid bone. Hence, the fissure, or the opening that enters into the Pterygopalatine fossa, is referred to as the pterygomaxillary fissure. Again, this fissure is represented by the green dotted line. Medially, the Pterygopalatine fossa is bounded by the perpendicular plate of the palatine bone, and laterally it is bounded by the infratemporal fossa. Within this relatively small space of the Pterygopalatine fossa lives the maxillary artery and its terminal branches. In addition, after the maxillary nerve exits the middle cranial fossa via the foramen rotundum, It too enters into the Pterygopalatine Fossa, where it gives off a number of branches. And thirdly, there's a very important Pterygopalatine ganglion. This is a parasympathetic ganglion which will allow for the synapse between pre- and postganglionic parasympathetic fibers. The Pterygopalatine ganglion is closely associated with the maxillary nerve. The Pterygopalatine fossa communicates with a number of different spaces and regions of the head via 7 different openings into or out of this space. The largest opening between the infratemporal fossa and the Pterygopalatine fossa is the pterygomaxillary fissure. The maxillary artery within the infratemporal fossa passes through the pterygomaxillary fissure in order to enter the Pterygopalatine fossa. Located just inferior to the pterygomaxillary fissure is the opening of the palatine canal, shown here. This canal will transmit both the greater and lesser palatine nerves and the descending palatine artery. The descending palatine artery is one of the terminal branches of the maxillary artery. The descending palatine artery bifurcates distally into the greater and lesser palatine arteries, which supply both the hard and soft palate respectively. Along the superior-posterior aspect of the pterygopalatine fossa is the foramen rotundum, shown here. This opening transmits the maxillary nerve. Just below the opening of the foramen rotundum is a small opening for the pterygoid canal. The pterygoid canal transmits the nerve of the pterygoid canal, also referred to as Vidian's nerve. Vidian's nerve carries preganglionic parasympathetic fibers from the facial nerve to the pterygopalatine ganglion, which again is located within the pterygopalatine fossa. We'll look at the details of this pathway in a moment. The third foramen along the posterior wall of the pterygopalatine fossa is the palatovaginal canal. This canal happens to transmit a pharyngeal branch of the maxillary nerve and its vessels in order to supply the posterior aspect of the roof of the nasal cavity. Of all of the openings discussed, this by far is the least important. The next major opening is in the medial wall of the pterygopalatine fossa, and it's referred to as the sphenopalatine foramen. The sphenopalatine foramen will transmit both the nasociliary nerve and the sphenopalatine artery into the nasal cavity. And the last opening along the anterior aspect of the pterygopalatine fossa is the inferior orbital fissure. This fissure allows for the infraorbital nerve to be conveyed anteriorly along the floor of the orbit. Here is another look at some of the openings just presented. In lab, I strongly encourage you to look at these openings on a real skull. Here in the right-hand image, the area outlined by green represents the pterygomaxillary fissure. Again, this opening allowed for communication between the infratemporal fossa laterally and the pterygopalatine fossa medially. Once inside the pterygopalatine fossa, if you continue to go medially, the next opening you'll encounter is the sphenopalatine foramen, which enters into the nasal cavity. And in the bottom left image, here is the small opening of the pterygoid canal. Here is a video which nicely describes the pterygopalatine fossa and its contents.
The pterygopalatine fossa is in here. To get a clear look at it, we need to remove the zygomatic arch. This is the pterygopalatine fossa. It lies between the pterygoid process and the hollow part of the maxilla. It's closed off medially by the perpendicular plate of the palatine bone. Above, it opens into the inferior orbital fissure. The terminal branches of the maxillary artery and all the branches of the maxillary nerve pass through the pterygopalatine fossa, and the pterygopalatine ganglion lies in its depths. The lateral entrance to the pterygopalatine fossa is called the pterygomaxillary fissure. Entering the pterygopalatine fossa and looking straight ahead, that's directly medial, we can see a large bony opening. That's the Sphenopalatine foramen. It opens into the nasal cavity. The nasopalatine nerves and the Sphenopalatine artery pass through it. Looking down and a little backwards, we find this bony opening, the outlet of the pterygoid canal. The nerve of the pterygoid canal emerges here with its mix of autonomic and special sensory fibers. Moving laterally and looking a bit higher, we come to this round opening, the foramen rotundum. The maxillary nerve, V2, emerges through it, immediately dividing into its branches. As we come out laterally and look downward, we can see the openings for the greater palatine and lesser palatine canals, for the correspondingly named nerves and blood vessels. These pieces of wire give us a simplified view of the main branches of the maxillary nerve as they emerge together from the foramen rotundum. The yellow wire represents the nasopalatine nerve, passing medially through the sphenopalatine foramen. The white wire indicates the infraorbital nerve. We'll see where it goes in a minute. The two red wires represent the posterior superior alveolar nerves, which enter these small holes in the maxilla. The gold and green wires show the greater and lesser palatine nerves, passing downward to enter their respective canals. Let's see where these nerves come out, starting with the nasopalatine nerve, which we saw passing through the sphenopalatine foramen here. We can see the same exact point again if we go right round to the front and look up into the nasal cavity. Here's the sphenopalatine foramen. In reality, the nerve, represented by the wire, branches here to supply both the septum and the side wall of the nasal cavity. The infraorbital nerve passes forwards across the inferior orbital fissure and enters a bony tunnel in the floor of the orbit, the infraorbital canal. It emerges here below the orbital margin to innervate the front of the cheek. The posterior superior alveolar nerves pass forward in the maxilla, branching to supply the upper teeth, and linking with the middle and anterior superior alveolar nerves, which are branches of the infraorbital. The greater and lesser palatine nerves pass straight downwards in their bony canals. To see where they come out, we'll go round to a view from underneath. Here they are, emerging from the greater and lesser palatine foramina. The last part of the maxillary artery passes into the Pterygopalatine fossa, dividing into its final branches. These include the descending palatine, the infraorbital, and the sphenopalatine, which passes through the sphenopalatine foramen along with the nasopalatine nerve.
Now let's take a closer look at the terminal branches of the maxillary artery. After coursing through the infratemporal fossa, the maxillary artery enters into the pterygopalatine fossa via the pterygomaxillary fissure. Once inside the pterygopalatine fossa, the maxillary artery gives rise to 6 different branches. Of these branches, 3 are of greatest importance. The maxillary artery will terminate as the sphenopalatine artery, shown here, and the descending palatine artery. The sphenopalatine artery traverses the sphenopalatine foramen on its course to the nasal cavity. The descending palatine artery exits the pterygopalatine fossa via the palatine canal. Within the canal, the descending palatine artery bifurcates to become the greater palatine artery and the lesser palatine artery. The greater palatine artery will supply the hard palate, and the lesser palatine artery will supply the soft palate. And the third major branch of the maxillary artery within the pterygopalatine fossa is the infraorbital artery. The infraorbital artery exits the fossa via the inferior orbital fissure, and it courses through a small canal to exit onto the face at the infraorbital foramen. Arising from the infraorbital artery are small branches that supply the anterior teeth, referred to as the anterior superior alveolar arteries. Now let's explore the nerves transmitted through the pterygopalatine fossa. The maxillary nerve is the second division of the trigeminal nerve, cranial nerve number 5. The maxillary nerve is abbreviated V2. The maxillary nerve leaves the middle cranial fossa by way of the foramen rotundum to enter the pterygopalatine fossa. Once within the fossa, the maxillary nerve gives rise to numerous sensory branches. Recognize V2 has no motor component. In the right-hand image, we see V2, the maxillary nerve, exiting the middle cranial fossa and entering into the pterygopalatine fossa via the foramen rotundum. Once inside the pterygopalatine fossa, the maxillary nerve gives off numerous branches. The first branch we'll discuss is the nasopalatine nerve. This nerve quickly exits the fossa to enter into the nasal cavity via the sphenopalatine foramen. The nasopalatine nerve conveys general sensory information from the anterior hard palate of the oral cavity and from the nasal septum. In addition, it also transmits parasympathetic fibers to the mucous glands associated with the nasal cavity. Next is the zygomatic nerve, shown here. This nerve further divides into a zygomatico-temporal and a zygomatico-facial nerve. These nerves will respectively supply the skin of the upper cheek and the anterior temporal fossa. And next is the infraorbital nerve, as shown here. The infraorbital nerve is a relatively large branch of the maxillary nerve, which courses anteriorly to exit onto the face at the infraorbital foramen. This nerve supplies the skin over the area of the maxilla and the lateral nose. Also notice that small branches referred to as anterior superior alveolar nerves extend from the infraorbital nerve to supply the anterior teeth. The infraorbital nerve reaches all the way down to the upper lip. And lastly, there are the greater and lesser palatine nerves, which descend from the pterygopalatine ganglion, as shown here. These nerves will exit onto the hard and soft palate via the greater and lesser palatine foramina. The greater palatine nerve will supply the majority of the hard palate within the oral cavity, while the lesser palatine nerve will supply this soft palate. I would like to use this image to point out the course and distribution of the nasopalatine nerve, shown here. Recall that the nasopalatine nerve exits the pterygopalatine fossa along with the sphenopalatine artery via the sphenopalatine foramen. Once inside the nasal cavity, the nasopalatine nerve descends obliquely along the nasal septum, and here at the incisive canal or foramen, the nasopalatine nerve enters into the oral cavity to supply the anterior aspect of the hard palate. Notice how the remainder of the hard palate of the oral cavity is supplied by the greater palatine nerve, shown here. And again, the soft palate is supplied by the lesser palatine nerve. Now let's take a closer look at the autonomic pathway, which involves parasympathetic fibers being conveyed to the glands of the head, specifically the lacrimal gland and the glands associated with the nasal cavity and the palate. The story begins with the facial nerve, cranial nerve number 7. Preganglionic parasympathetic fibers are conveyed through the facial nerve, and in the area of the geniculate ganglion, those fibers are then conveyed through the greater petrosal nerve. As a reminder, the geniculate ganglion houses the cell bodies for taste associated with the facial nerve. The greater petrosal nerve, shown here, originates from the geniculate ganglion and it exits the middle ear cavity via the greater petrosal hiatus. It then slides along the floor of the middle cranial fossa and it exits the middle cranial fossa via the foramen lacerum. In the area of the foramen lacerum, the deep petrosal nerve, shown here, unites with the greater petrosal nerve. The deep petrosal nerve is coming from the internal carotid nerve plexus. The deep petrosal nerve is purely sympathetic. Once these two nerves unite, they form the nerve of the pterygoid canal, also referred to as Vidian's nerve. Vidian's nerve courses anteriorly and it ends at the pterygopalatine ganglion. At the pterygopalatine ganglion, the preganglionic parasympathetic fibers synapse with the postganglionic parasympathetic fibers. The postganglionic parasympathetic fibers are then conveyed through various nerves to reach their target tissues. The postganglionic parasympathetic fibers, which are destined for the lacrimal gland, will be conveyed through a communicating branch of the zygomatic nerve. Parasympathetics destined for small mucus glands in the nasal cavity will be conveyed through the nasopalatine nerve, and those being conveyed to the palate and the associated glands will be conveyed through the greater and lesser palatine nerves. In general, all the glands above the oral cavity are supplied by parasympathetics which are conveyed through the greater petrosal nerve. Glands below the oral cavity are supplied by parasympathetics which are conveyed through the chorda tympani nerve. At this point, you have now been exposed to all the pathways by which parasympathetics are conveyed to the various glands of the head. Use this slide as a reference slide to review the various pathways. For the remainder of this presentation, let's focus now on the nasal cavities. The paired nasal cavities are the uppermost aspect of the respiratory tract. These elongated, wedge-shaped spaces have a large inferior base and a very narrow superior apex. The nasal cavities contain olfactory receptors for olfaction, and they are held open by a skeletal framework that primarily consists of bone and cartilage. The nasal cavities have both an anterior and posterior opening. The anterior openings are referred to as the nares, or the nostrils. The posterior openings are referred to as the choanae. The choanae communicate between the nasal cavities and the nasal pharynx. Over the next series of slides, we'll take a closer look at the boundaries of the nasal cavity. The anteriormost aspect of the nasal cavities is the external nose. The external nose helps to extend the nasal cavities onto the front of the face, and it ensures that the nares are positioned downward. The external nose is formed by bone, by way of the nasal bone. This bone is said to form the area of the bridge of your nose, and it's also formed by cartilage. All of the cartilages of the nose are made up of hyaline cartilage. In the midline is the septal cartilage, which runs straight down the middle of the nose. Just laterally to the septal cartilage are two lateral processes. And the various alar cartilages help to keep the nares open. If an individual receives a nose piercing, the piercing is done between the minor alar cartilages and the major alar cartilages in this region here. The roof of the nasal cavity is very narrow and is bound by the cribriform plate of the ethmoid bone. Recall that the cribriform plate has a number of foramina through it, which are traversed by the olfactory nerves, shown here. The anterior portion of the nasal cavities is bounded by the frontal bone, the spine of the nasal bone, and those alar cartilages. And posteriorly, the nasal cavity is bound mostly by the sphenoid bone. And this area here represents a choana, which is the communication between the nasal cavity and the nasal pharynx. The floor of the nasal cavity is the hard palate, which is also the roof of the oral cavity. The hard palate is formed by the palatine process of the maxillary bone, as shown here, and is also formed by the horizontal plate of the palatine bone posteriorly, shown here. The palate is covered by mucoperiosteum, which firmly attaches to the bones of the palate and contains within it numerous mucus-secreting glands, especially along the posterior portion of the palate. And as we just mentioned a few moments ago, these glands of the palate are innervated by the greater and lesser palatine nerves, which are conveying parasympathetic information down from the pterygopalatine ganglion. The greater palatine foramen shown here is the continuation of the palatine canal. Emerging through this foramen are both the greater palatine artery and nerve, which supply the majority of the hard palate. The lesser palatine foramen, shown here, is the smaller continuation of the palatine canal, and it will convey both the lesser palatine artery and lesser palatine nerves, which will supply the soft palate. And lastly, the incisive foramen is another opening onto the anterior portion of the hard palate. This foramen will convey the nasopalatine nerve, which is a branch of the maxillary nerve. The nasopalatine nerve courses obliquely through the nasal cavity along the nasal septum, and it enters the oral cavity here at the incisive foramen. It will also supply the anterior portion of the hard palate, as shown here. Coursing in company with the nasopalatine nerve is the sphenopalatine artery, which anastomoses with the greater palatine artery. The medial aspect of each nasal cavity is bounded by the mucus-covered nasal septum. This vertically oriented nasal septum separates the left from the right nasal cavity. The nasal septum is comprised primarily of septal cartilage, shown here in blue, but it also has two bony components. The perpendicular plate of the ethmoid bone, here in green, is the upper part of the posterior aspect of the nasal septum, and the posterior-inferior aspect of the nasal septum is made up of the vomer, which is another bone. Together, these two bones and the cartilage make up the entirety of the nasal septum. Typically, the nasal septum is relatively smooth, flat, and runs in the midline between the two nasal cavities. On occasion, the nasal septum can deviate to one side of the nasal cavity or the other. Severe deviations can be corrected surgically. The lateral wall of the nasal cavities is made up of bone, cartilage, and soft tissue. Structurally, the lateral wall is formed by portions of the ethmoid bone, the palatine bone, the sphenoid bone, as well as the lacrimal and maxillary bones, in addition to the inferior nasal concha. There are a series of curved turbinates emerging from the lateral wall. These turbinates are referred to as the concha. There's an inferior nasal concha, a middle nasal concha, and a superior nasal concha. These concha help to make the flow of air more turbulent as it courses through the nasal cavities. By doing this, it allows the air to stay within the nasal cavities longer for humidification. If we look more closely at the nasal cavities, we see that these paired projections, called the nasal conchae, extend medially across the nasal cavity and help to separate the cavity into four separate air channels. The top two conchae are bony landmarks associated with the ethmoid bone. The top two conchae would be the superior and middle nasal concha. The inferior nasal concha is considered to be its own bone. These concha are sometimes referred to as turbinates. These turbinates help to increase the surface area of the nasal cavity to allow for humidification, filtration, and temperature regulation of the air we breathe. The longer the air stays within the nasal cavities, the warmer and more humidified it becomes. Located beneath each concha are meatuses. So beneath the superior nasal concha is the superior meatus. Beneath the middle nasal concha is the middle meatus. And beneath the inferior nasal concha is the inferior nasal meatus. As you may recall from the lecture on the orbit, the nasolacrimal duct empties into the inferior nasal meatus. And above the superior nasal concha is an area referred to as the sphenoethmoidal recess. This recess is where the sphenoid sinus drains to. Blood supply to the nasal cavities is accomplished through both the external carotid artery and the internal carotid artery. Recall that the external carotid artery terminates as both the maxillary and the superficial temporal arteries. The maxillary artery courses through the infratemporal fossa. It courses through the pterygomaxillary fissure in order to enter the Pterygopalatine fossa, and then a branch of that artery, referred to as the sphenopalatine artery, exits the Pterygopalatine fossa to enter into the nasal cavity via the sphenopalatine foramen. While the sphenopalatine artery is the major blood supply of the nasal cavity, it is not the only blood supply. In addition, there are small anterior and posterior ethmoidal arteries which originate from the ophthalmic artery, which courses through the orbit. The ethmoidal arteries tend to supply the superolateral aspect of the nasal cavities. In addition, the very anterior aspect of the nasal cavities can also be supplied by the septal branch of the superior labial artery, which comes from the facial artery. This small septal branch supplies the anterior part of the nasal septum. In summary, the major blood supply to the nasal septum and the nasal cavities is via the sphenopalatine artery, with contributions from the ophthalmic artery, specifically from branches referred to as the posterior and anterior ethmoidal arteries, as well as small contribution from the septal branch of the superior labial artery. Near the lower anterior end of the nasal septum, there is an anastomotic area of vessels known as Kisselbach's area. It is in this area where branches from the sphenopalatine artery, the anterior ethmoidal artery, and the septal branch of the superior labial artery anastomose. The mucous membrane in this area happens to be very thin and is very vulnerable to trauma and bleeding. The term epistaxis is used to describe a nosebleed. There are two types of nosebleed. There's an anterior and a posterior. Anterior nosebleeds are the most common, and they typically involve Kisselbach's area. Anterior nosebleeds are common among children who like to pick their nose, for example, and they're also common in the winter, especially when there is low humidity in the air. And of course, trauma is another source of an anterior nosebleed. Anterior nosebleeds are typically managed by applying pressure to the nostrils or the area of the bleed. Posterior nosebleeds are less common, but are much more severe because the diameter of these vessels is much larger. Posterior nosebleeds tend to increase in frequency with aging and can be very difficult to control. Electric cautery may be needed to manage these more serious forms of a posterior nosebleed. The veins draining the nasal cavities course in company with the arteries. Veins that course in company with branches of the maxillary artery will drain to the pterygoid venous plexus within the infratemporal fossa. The veins associated with the anterior region of the nasal cavity will drain into the facial vein ultimately. And from there, you know that the facial vein eventually makes its way back to the internal jugular vein. And lastly, the veins that accompany the anterior and posterior ethmoidal arteries will drain to the cavernous sinus. Sensory innervation to the nasal cavities is accomplished through three different nerves. The olfactory nerve, cranial nerve number 1, will be responsible for olfaction. This nerve contains special sensory fibers which are conveyed through the cribriform plate, and they meet up with the olfactory bulb in the anterior cranial fossa. Recall that the olfactory nerve is not a single nerve, but rather it represents a collection of multiple neural filaments that supply the olfactory epithelium at the roof of the nasal cavity. The anterolateral walls of the nasal cavities are supplied by branches of the ophthalmic nerve. Specifically, notice how the anterior ethmoidal nerve enters into the nasal cavity. It gives off the external nasal branch, which goes down to supply the very tip of the nose externally. And then it also gives off lateral nasal branches and internal nasal branches, which supply the lateral wall of the nasal cavity. Again, these are all branches of V1, the ophthalmic nerve. And lastly, the majority of the nasal cavity is supplied by branches of the maxillary nerve, V2. For example, here's the nasopalatine nerve we've discussed at length. This nerve will innervate the lower part of the nasal septum. And there are also smaller branches referred to as the posterior superior medial nasal nerves, shown here along the nasal septum, as well as posterior superior lateral nasal nerves that will supply the lateral wall of the nasal cavities. All of these nerves are collectively branches of the maxillary nerve, V2. The paranasal sinuses are mucous membrane-lined cavities which are filled with air, and they communicate directly with the nasal cavity. Just like the nasal cavities are lined by respiratory epithelium, so too are the paranasal sinuses. Because the paranasal sinuses maintain connections with the nasal cavity through small openings or ostia, these connections can serve as pathways for the spread of infections from the nasal cavity to the paranasal sinuses. Mucosal swelling at an ostium, for example, can block the drainage of a paranasal sinus. And whenever you have an infection of a paranasal sinus, it can produce a lot of pressure and even localized pain, which is referred to as sinusitis. For example, maxillary sinusitis is inflammation of the maxillary sinus. This inflammation can mimic that of a toothache because this area is supplied by the same cranial nerve, specifically the maxillary nerve. In total, there are 4 different paranasal sinuses. The frontal sinuses are located in the frontal bone, in the area of the eyebrows. The maxillary sinuses are the largest of the paired sinuses, and they are located in the maxillary bone. The ethmoidal air cells are comprised of about 10 to 15 small air cells within the ethmoid bone. These air cells can be designated as anterior, middle, or posterior ethmoidal air cells. Because the bone of the ethmoid is very, very thin, ethmoid sinusitis could actually erode away that thin bone, and the infection can spread to the orbit. And lastly, at the posterior superior aspect of the nasal cavities are the sphenoid sinuses. These sinuses drain into the sphenoethmoidal recess, which was mentioned earlier. In general, the paranasal sinuses function to lighten the weight of the skull, and they serve as resonating chambers in order to bring out the fullness of one's voice. In addition, the paranasal sinuses also help to humidify and warm the air we breathe. From this mid-sagittal section, you can better appreciate the sphenoid sinus located here in the superior posterior aspect of the nasal cavity. And notice how the sphenoid sinus opens into the sphenoethmoidal recess. Let me also point out that the area indicated by the X is the hypophyseal fossa. This fossa houses the pituitary gland. In the case of a pituitary adenoma, the quickest approach to surgically remove the inflamed pituitary gland is actually through the nose, so it's referred to as a transnasal approach. A probe is inserted, they chip through the sphenoid sinus, and they access the hypophyseal fossa to remove the cancerous pituitary gland. Now let's take a look at the openings for the other paranasal sinuses. Here's the frontal sinus within the frontal bone. The opening of the frontal sinus is here in the superior aspect of a semilunar hiatus. This opening is referred to as the frontal nasal duct. The frontal nasal duct is a small tube which connects the frontal sinus to the middle meatus. Also here under the middle concha is a large bulla referred to as the ethmoidal bulla. This ethmoidal bulla has the openings of the middle ethmoidal air cells emerging onto it. And at the leading edge of this bulla and beneath this bulla is the semilunar hiatus. Also opening into the semilunar hiatus is the largest opening referred to as the maxillary ostium. This is the opening which communicates with the very large maxillary sinus. And the last major opening into the nasal cavity is from the nasolacrimal duct, which empties into the inferior nasal meatus, just underneath the inferior nasal concha. This is how tears are drained from the eye to the nasal cavity. And lastly, I'll also mention within the nasopharynx is the opening of the pharyngotympanic tube, or the opening of the eustachian tube. This opening is what allows for pressure equilibration between the middle ear cavity and the nasal cavity, or specifically the nasopharynx. And while I'm on this slide, let me also point out that during dissection, you'll want to identify the middle nasal concha, shown here. The very posterior tip of that middle nasal concha will come to lie roughly in this area indicated by the black dot. That black dot also happens to be the area where you will find the pterygopalatine ganglion. To dissect out this ganglion, you will very carefully chip through the bone of the lateral wall of the nasal cavity in order to expose it. So as your reference landmark, use the middle nasal concha along the posterior aspect to find where to start chipping through the bone. As always, thanks for listening. This concludes the presentation on the Pterygopalatine fossa, the nasal cavities, and the paranasal sinuses. Happy studying!